Thank you, everyone. And I'm filling in for Dr. Mandana Khalili, who directs our investigator skills development working group. Welcome to today's webinar. In addition to research skills, we also are interested in helping people develop their professional and career skills. And in this current environment in academic research that we find ourselves, it can be quite challenging to keep yourself funded. So one of the things that myself and some the really excellent mentor you're going to hear from in just a moment like to persuade people to do, that it's really important to help in your career to diversify your funding portfolio. And you'll hear that message a lot, but like, how do you actually go about doing that? So today we're very fortunate to have Dr. Stuart Gansky, who is professor and Lee Hyson Chair of Oral Epidemiology in the School of Dentistry and director of the UCSF Center to Address Disparities in Children's Oral Health, or also known as the CAN-DO Center. He's also one of the multiple principal investigators of the Research Coordinating Center here within at UCSF for our Health Excellence Action Network and the Multiple Chronic Disease Disparities Reduction Network. Dr. Gansky is an amazing and award-winning mentor. He's mentored like close, probably over 100 of students. He's received our own Academic Senate Distinction Award for mentoring, and he recently won a national award, the Irwin D. Mandel Distinguished Mentoring Award. So he's one of my favorite people to learn about how to be a really excellent mentor. In addition, Dr. Gansky has been the Associate Dean for Research in the School of Dentistry, and so has a really good feel for what in funding environments are, and how early stage career individuals can keep themselves well supported in order to advance their careers. So we're very fortunate to have Dr. Gansky with us today. Stuart, thank you for being with us today. Thank you.
Well, thank you for that very kind introduction. It's a pleasure to be with everybody today, and I would like to give the disclaimer that I changed the title slightly. I have been sort of growing your research portfolio, but it's sort of the theme, but diversifying your research portfolio, with it being spring and things being green and in bloom. I thought that it was appropriate to use that as the metaphor that out in your garden, it takes a while to prune back things, to prepare the soil, make it rich, plant the seeds, keep things watered, keep things growing. So that's sort of the metaphor for this. And as Edwin said, I have had the privilege and honor to have had wonderful mentors myself, who encouraged me to apply for different kinds of research funds, small, large, some NIH, as well as funds from California, from the University of California, from the state of California, and from some foundations. So it's one of the things that people don't talk about a lot. Is sometimes it's useful not just to have a diversified portfolio to ensure if there's a decrease in funding in a certain by a certain funder, or a change in priorities, that you're insulated against those, but also because different kinds of organizations and the funds they provide can be used sometimes for different things. They sometimes have different restrictions. And so it's sometimes helpful to be able to have funding from these various sources so that you have funds that you can use for different purposes. My other disclaimer is that I am not an expert on Pivot RP or on AI funding discovery tools, but I have used them. I've been using Pivot for um, almost 20, about 15 years, I guess, and I have recently been using the AI tools. Um, and then for the purposes of putting together this talk, I also explored some other components about them, and I discovered that Pivot had changed quite a bit since the last time that I used it. So I'll be sharing some of those newer features that I think make Pivot a lot easier to use and provide better searches. So let's go ahead and get started, and we will have time for questions. Feel free to put questions in the chat as we go along. We'll have time at the end. And depending on how timing goes, I think that I will have time to also do a little bit of a live demo for people who are interested in that. So let's go ahead and get started. First of all, support for this presentation and the information in here about training and finding research funding for early stage investigators and for clinical and translational researchers comes from these two NIH awards. So I'm grateful for their support. Other than that, I have no financial relationships with any of the products or companies discussed in this presentation, so nothing to declare. These are the learning objectives for today, which you may have already seen. The first is to be able to identify tools that can help you tailor a search for possible funders of your research, to configure and refine a Pivot RP search for funders or funding opportunities, to develop and refine a Pivot RP funding alert that will send you information as soon as Pivot has it in its database, to develop and refine a prompt for a large language model AI tool to use for customize it based on your training, expertise, and experience, so you can search for funders and funding opportunities. In doing this talk, putting together this talk or thinking about it a couple months ago, I went to review what kinds of other databases are out there besides Pivot. And there is a tool called Atom, and there's also something called GrantWatch, which has some AI features. You may or may not be part of an institution that subscribes to any of these. Some institutions don't have any of them, and that's okay because you can still use Pivot to some extent, and you can still use large language model tools. So here in this table, I put together the pros and cons, the audience that this is geared towards, and the cost as far as I could find, which is mostly proprietary and unavailable. Atom seems to have marketed itself as a new tool that is completely AI driven. But as I found out, Pivot has changed quite a bit and now has a lot of AI components in it as well. And I think has been yielding better results. So there are some institutions, I can't remember uh, I can't remember which institution it is that I checked that does have Atom. I can't remember if it's part of the consortium or if it's where I have a different colleague who is a member of that institution. But much fewer institutions, much less market penetration. Um, anyway, these are the and GrantWatch is more, it seems, for nonprofits, small businesses, maybe community-based participatory research, community-based organizations. Um, so, what is Pivot? Why is it important? Why might it be helpful? So Pivot, it has you can access it through this link in this dashboard shown here. Pivot has over $100 billion worth of funding in its database. When you go through, you find that there's more than 27 billion that's focused on health and medicine, more than 6 billion on disease. And for example, more than 400 million on obesity. So there's quite a bit of information that's in here that's helpful. So even without um, having your institution have access to it, you can do a simple search and an advanced search without having to have any subscription. The way you do that is right at this at the landing page where it says select funding opportunities. This big bar in the middle, it says search for funding. Um, Thank you, Rochelle, for putting the links into the chat. So if you do a search, and in addition, I want to also point out that ProQuest Pivot, which is part, I guess, of Clarivate, which is the company that owns Pivot, has quite a bit of training, short training videos that are available on YouTube. So, for example, this one talks about searching and browsing for funding opportunities. This one talks about navigating the funding results page, and you know how to, when you go click on a link, what each piece of information is and how to understand it. And then as another example, there's one on the advanced search functions. And so there's quite a bit of training that's available online for free. I think this is good because it's just in time kind of training, short videos rather than taking a whole hour long, 2 hour long, half day, whatever it is, workshop to become an expert. You can dip your toe in, you can find what you need to when you need to. Okay, so let's say we want to do a search for funding. Let's say we want to find some funding to look at the relationship between periodontal disease and diabetes, and maybe you're interested in doing some kind of upstream intervention research that's focused on nutrition or diet, or focused on the oral gut microbiome. So if you just do a simple search, periodontal and diabetes. It uses simple Boolean and or not kinds of commands. I put in periodontal and diabetes and I get nothing. So, all right, your initial search is disappointing. I find that what happens is it's similar to searching for the literature in PubMed. Depending on what your first attempt is, you either get nothing or you get 1,000, and neither of them are very workable or helpful. And so you need to refine. So you can refine your search. I think that refining your search using the advanced search function, and on the right here, you can see that there's the advanced search here. So you can click on the advanced search and then refine your search. So if I put in oral health or dental or dentistry and diabetes or cardiometabolic or diabetic, and then do a search, and then also there's other um, fields that you can use. So I also want to look at um, that if you are in the United States and you're intending to conduct the activity in the United States, and your citizenship is the United States, but you don't have to keep this part. You don't have to do any of these. You could keep them unrestricted. But I have found that I've gotten a lot of results for um, Australia or Europe or other places where the funds are in those dollars and they're intended to be for people who live there and people who are conducting the research there. So if we run this search, we get 28 results. Um, and you can see there's one that's Blue Cross Blue Shield of South Carolina. When I clicked on this, which I won't show you, it says it's restricted to being conducted in South Carolina. I'm not sure if it's restricted to people who live in South Carolina, but it's important to look at all of those. Then there's a whole bunch of NIH opportunities, some of which I had forgotten about or never heard about. So, for example, there's Native American Research Centers for Health, or NARCH. There's a whole bunch of grant opportunities, funding opportunities that are in this category, and so that may be of interest to you if you're doing work with partners who are Native Americans. And so that may be of interest to you, and that may be news to you. But there's a whole bunch of other ones as well. Um, if you look at this search, um, you can change the search. You can also put in a search like this, like you might be able to or might do in um, um, PubMed, where you're just putting in ands and ors and parentheses to separate them. For this search that I did here, you might notice that there's only three options here. Um, and so if I wanted a fourth option, I actually copied what the text was and then added another option. So here I added a slightly different search: multiple and chronic and conditions, or multiple and chronic and disease, or chronic and diseases, and oral and health, or dental or dentistry. So basically looking for multiple chronic conditions or diseases and dentistry or oral health. And so then this search, which is slightly different than the previous one, comes up with 9 results that are listed here. So this is a new posting. This one just came out. I think it was April 27th. Community-based participatory research to advance data and practice transformation, ADAPT, which is a new initiative from the National Institute of Health, from the National Institute of Dental and Craniofacial Research. And this is for optimizing oral health for all. So this is really focusing on reducing disparities in health. And this is one where upstream research on upstream factors that affect oral health as well as other health conditions like diabetes could be possible. There's other results, though. So there's this Applied Epidemiology Fellowship Program. This is you can see a maximum of about $71,000. And this is modeled after the CDC's EIS program, Epidemic Investigation Service, but it's at the state level. And so if you have finished your training recently, this is essentially like a postdoc position. And I think like EIS, it's probably very interesting and very exciting is it's often focused on infectious disease outbreaks, at least at the CDC level, and I think at the state level it would be, but also on chronic diseases. Um, and then there's some additional ones. For example, this Duke Endowment. I checked that one. That is for people who are in South or North Carolina. Um, this Healthy Seniors, Healthy Youth grants. I shared this from Pivot with Phil Levy and Achieve Greater. This is in the 4-county community foundation, and these are 4 counties that are just north of Wayne County in Michigan, that are northern suburbs of Detroit. So there may be people at Achieve Greater who would be interested in this opportunity.
It's
Um,
nice that it's pulling up, federal, governmental, but also foundations and things
yeah,
like that. So
yeah.
that's really powerful, I think.
Yeah, I was a little disappointed that there weren't more foundations, but I think it's because this specific search was so particular, and in what has come up is not foundations that are really looking for diabetes and oral health or periodontal health, but diabetes or oral health, and so, I think that's one of the reasons. And if I had done a search that was only focused on periodontal, on diabetes, or only on oral health, it would have come up with more foundations. Um, Whoops. And so this is yeah. So these searches are coming up with um, lots of different, but they're not, huge amounts. So this one's what, 9, and the other one was 28. So and then there's NIH ones. Um, And so, also, if you can tuck away this adapt one, I have a story at the end about this adapt one that I wanted to mention at the end of the talk also. Just put that one in your memory bank. So those are the features that anyone has in Pivot. But access to Pivot accounts and profiles require a login, requires institutional membership, as you may remember from that table that I showed. And in the consortium, um, all of the centers, except for one, seem to have at least one institutional member that is part of Pivot. So that is good news. What you get out of it is you get some additional functionality. But first, how do you create a login? How do you get there? So when you click the sign in button for Pivot, you might think, oh, I should do the institutional login. But there are many fewer institutions listed there. So when I go to look for UCSF, if I type in SAN, there's one UC campus, which is San Diego, but that's it. The rest of the other 9 UC campuses are not on that login with your user credentials. And so you have to click create an account if you don't have one already. If you have one already, you can retrieve your password very easily. And and when you click create your account, the screen asks you to fill in your name and your location and so on. But then, sort of towards middle of the screen, there's a pull down, and that's where you can find many, many, many more institutions. So this is where I found University of California, San Francisco, or UCSF. So be sure to look for your institution there.
Yeah. It should have
And
pulled it up on that front page, but it doesn't.
yeah, I mean, it
I
just
have no
isn't.
explanation.
Well, I mean, they just haven't, bothered to do the single sign-on, which is fine. And I did check, and this is where I got the list for all the other HEAN consortia of which ones are on and which ones aren't. I did check all
Mhm.
the institutions. Um, so then once you're logged in, so you can see my name at the top right shows I'm logged in. Um, then you can go to your profile and set up your profile. The easiest thing to do is to and then you can click edit profile. Mine isn't blank, it's already filled in. The easiest thing to do is to connect your ORCID ID, your ORCID number um, to this, and then it will pull a lot more information in. Otherwise, you can do manual editing. And you might think, why is this worth it? Why should I bother doing this? I'm just going to do some searches and that be done with it. It actually uses this information to do the AI searches. So the information you're putting in here is really helpful for what it calls the advisor. And I also put in my institutional website as well as a couple others that aren't displayed here. Um, and it pulled in my expertise, and then I was able to edit that. So that was a lot easier. It also pulled in keywords, and I was able to add keywords. And again, it uses these keywords to help with its AI tools for coming up with recommendations to search for you. So you can then go to Advisor, back to from the landing page. You can click on the Advisor and see where that takes you. And in this case, the advisor has suggested um, 25 funding matches after I clicked research project grants and innovation. It also had these other categories of clinical trials, collaboration opportunities and networking, fellowships and postdoc awards, scholarships, and I think there's another one for conferences. And so I thought that there were a total of 44. So at one point. So I reduced this down to 25. And then here's where you can see a lot of other foundations. As it turns out, I don't think that any of these, I only think one of all of these foundations might be interested in the search that I just did of looking at um, the intersection of diabetes and periodontal disease and diet, nutrition, and microbiome. And that's this one, this international grant from the Microbiota Foundation, which is a foundation that I never heard of. So this was a new one for me to explore. You can see right here on the landing page that it says 200,000 euros. So right away you know that it's somewhere in Europe, but it doesn't mean that you're not eligible. So it's worth exploring. Um, so this might be a good time to stop. We're about at the half hour mark of the hour. So this might be a good time to stop and see if there's any questions. I see that Rochelle put those um, those
Links.
links into the chat for me. Thank you for the trainings. And Edwin has pointed out that yes, Health for All is a uh, easy way to refer to the kinds of disparities, reducing disparities research that many of us are focused on.
Without triggering an AI search
Yeah,
for
without
DEI problems. Yeah.
creating ruffling feathers, we'll just put it that way. Okay, so I'm just gonna proceed then with the AI tools. So as I mentioned, Pivot RP now does have some AI capacity, and I have found that the searches have been much better and much more interesting to me. I should also say I did not point out or capture that when you do a search, let's see if there's the button displaying. I may have clipped it. Yeah, when you get a search result, um, I think I cut it off. When you get a search result, and you're logged in, you can save the search result. And the default is that it will send you new updates each week. So, so here you might notice this is where it's displayed. It says results for May 3rd. So that's for this week. And there was one new one this week. And so when you do a search and you save it, it will send you an email if there's some new result to that search each week, which is kind of nice because you don't have to log in and go there automatically and you can get that information. Um, so that's also one of the advantages of setting up a profile and saving your searches once you're happy with the search. Um, Okay, so it has some AI capacity, but it is not the same as one of the large language model tools. And so you may be familiar with using these large language tools for a variety of tasks and research tasks. And so I will say, give you some query or prompt engineering tips, and I will show you the query that I used. Basically, I think it's a good idea to ask for current or open federal, state, foundation, and industry funding opportunities. Ask for specific topics. Give it your career status or level and the kind of thing you're looking for. If you're looking for a postdoc, if you're looking for an early stage investigator opportunity or an assistant professor opportunity or someone within, say, 5 years of a terminal degree. This third bullet, I think, is really important, which is to provide it some more data about yourself, which could be your biosketch. It could be a document, or it could be a URL, a link. It could be your campus webpage or profile, or your ORCID profile, or some other place, a LinkedIn page, something where you can give it an address and it can go look up your credentials, your experience, your publications, and so on. And then, as I demonstrated with Pivot RP, if you get too few results, then you need to broaden your search. If you have too many results, then you need to be more specific. What's too many? It's hard to say. I would say, I have searched through 3 pages of results, and I would say that's about the most I would want to search through. If it's a new topic for me, too few, well, clearly 0 is too few, but probably, if you get 5, if you get less than 10, you might think about broadening. All right, so what is the AI prompt? So here's the AI prompt that I used. These are some tips that I've gotten before from people who have been using AI tools or large language model tools much more than myself, which is to tell it its perspective, right? And that is you're an experienced, powerful database, search platform, full featured, specifically designed to identify research grant funding. And then I gave it those same examples. Some people, depending on your task that you're giving it, will also ask it to give a confidence rating for each result. Um, and you'll see one of the tools did that without me asking. Um, and then sort of the question. So this is kind of like the background, and then the question, which is given my particular research training experience, grants, publications, and listed on these 2 profiles. Prepare a list of relevant opportunities, accepting applications for federal government, state government, foundation. I should have said university. I didn't, or university system. Foundation and industry research grants, particularly in the combined area. And I gave it a very specific um, uh, search here. And you can be a little more general or you can be specific as well. In the area of oral health dentistry or periodontology with diabetes or metabolic syndrome or obesity. So I added obesity here, such as upstream interventions focusing on promoting a healthy oral gut microbiome through healthy nutrition or diet and or reduced alcohol or tobacco exposure. So I gave it really quite a lot to chew on, just to see what it would give. And first, I did it in ChatGPT Enterprise, which UCSF has a license for and has um, it is for UCSF, it is behind a firewall, so that others wouldn't be able to see this specific search. So it came up with a bunch of federal grant opportunities. Some of these were on the other lists, some of them weren't. I think in part because I added this alcohol and tobacco portion, for example. Um, and in this PAR, which I went and looked at, a number of institutes and centers at NIH had specific notes of things they were interested in, including NIDCR and NIMHD. And so this is kind of hitting in both of those areas. Um,
So,
there's
Stuart,
also
would general GPTs so I'm just wondering how the large language model, like did somebody feed it, and is it currently being fed in real time, all the government grants and things like that? I wonder, is that something specific just kind of to university ones, or
um,
would the general
yeah,
use
so
GPTs have something similar?
I used it with the UCSF version of the Chat GPT Enterprise, and I also did the same exact search, same exact prompt for Claude, where I just used a general Claude account
Hmm.
that I had, and I had never used Claude in that way before. So really, there wasn't a lot that Claude was building on in terms of my searches. And I would say I didn't specifically ask it to go to grants.gov here, but um, I think it is a good idea you can give it
Put that
some
in your prompt,
examples
in your
of
prompt.
websites to go to. So, for example, you could put grants.gov. I could put um, grants.ca.gov, which is the California state government. You can put in certain foundations if you already have some ideas, and you can put them in and say that those are examples. You can put in certain industries if you're interested. Those are certainly ways you could refine your search and build it up. But without even, kind of naively putting this in, it came up with some good results that were a little bit different than a pivot RP. I think that these are all reasonable things given what I asked it. Um,
And they're real.
and they're right, they're real, they exist. I think that it's listing where it found it. So it's listing grants.gov and one or two other places where it found these. Um, and then um, I did notice that when I went to some of these PARs, the 2025 ones, that there is a banner that says that the PAR was changed. The language was changed and updated, in the spring of 2026. So we all know what that was about. So, but these are still existing. So I think these are good opportunities. It also identified that GLP-1s is an area where there is this shared interest in this Venn diagram of oral health and diabetes or metabolic health syndrome. And then it says that NIDCR is interested in oral health changes related to GLP-1s. So, if this is something you're interested in, it's come up with six different NIH funding opportunities. I think, yeah, and as it says, these last two are not notices of funding opportunity, but they do seem to be topics that are of interest. So there may be more uh, NOFOs coming in those areas, or you can use the existing ones and just highlight that this is an area of interest. For state government, this is the California Tobacco Related Disease Research Prevention Program. Um, there are some industry foundation and industry links it identified. Robert Wood Johnson Foundation, which many of us already know about. But it also identified CareQuest Institute, which I do know about. Um, and they do have this advancing equity through oral health fund. And so this is um, a foundation that is funded as a nonprofit that is funded through, I think, through Delta Dental as a nonprofit, and it's certainly through a health insurance company. Um, and then again, this one came up with this Biocodex microbiota, which is one of the ones on Pivot that I had not seen before. And here it says the USA call is open with the theme of harnessing the gut microbiome and impacts on health, disease, diagnosis, therapeutics. It's not a huge amount of money, but every little bit helps, particularly if foundation grants can be used to pay things that others cannot. And then it identified some industry like Colgate-Palmolive, again, kind of a smaller pot of money, and the American Diabetes Foundation. They, I think, just closed um, their awards, so you would have to wait about 10 more months for that to come back around. So those were some pretty good results, having just done one query with no back and forth refinement. You can, of course, and should do back and forth refinement and iterations after this. Have it ask, say, send me more like such and such if you find a couple that you find really appealing. And then I tried Claude, which I had not done, and I should say with Chat GPT Enterprise, I have done searches for grants before. So, and because it is the UCSF one, it knows it's me. It looks at my search history. It looks at the things that I asked it to give more detail. And so these results have already been the result of some, maybe 10 other back and forth items. Um, I will also say that I saw a demonstration about 2 weeks ago at UCSF in a webinar from someone from the Department of Medicine where he has developed a portal that, oh, and the other thing to do is when you get a search that you like this, then tell the large language model tool to please send you an email with an update every Monday. Why Monday? Um, NIH often will update its NOFOs Sunday night. It updates Reporter on Sunday night, so it just seems like to me it's a good practice. For picking a day of the week, you could pick some other day of the week, whenever it is that you might have time to read that email and take a look. And there's not going to be too many each week. Could be zero, could be one, two, could be just a few. Um, so this other person in Department of Medicine created a whole portal, a whole basically created is creating. He's not a population health science researcher. He's a basic science researcher, but he tailored and iterated. He said that he used, upwards of 100 back and forth messages. Asked that the results be put into CSV files and emailed, asked that he listed, it pulled in the names and email addresses of colleagues who are at UCSF and outside of UCSF who he collaborates with, probably two, 3 dozen people, and asks that the tool send them the results every week when there's new updates. And so he basically has created this tool for his community, his network of collaborators. And he said that he's working with others to create a more general purpose tool. So I would expect that these kinds of things will be under development, will continue to be under development and refinement and get better and better as time goes on. So that one was a little more refined because I had used it before. This one was very naive. I gave it the same exact starting prompt to Claude. Um, and let me just check okay, I see some chats. Uh, sorry. Okay, now you have it. I'm glad. Sorry you were having problems. Um, and thank you, Rochelle, for managing that. So this was very naive. This is just the first pass, and it still gave some pretty good results. Some overlap with what ChatGPT Enterprise gave, some new ones. And also, it gives this fit. You can see sort of, 5 stars for fit. And it also gives you a little bit of a nicer layout rather than just text where it's easier to parse the results, skim through them. And it's a long list. And so I've made them larger and put them on screens and cut them up. It also gives the dollar amounts, which are helpful depending on the budget and what you have in mind and what you're thinking about. This is a mechanism that I hadn't seen before, R61, R33. It's a phased mechanism, so it's 1 or 2 years of R61 and then 3 or 4 years of R33 if you meet the criteria. And again, this one is NIDCR plus some other institutes and centers. Um, and so it's helpful that it has that broken down that way. Um, so there's also precision probiotics. And again, this is only part of the phased mechanism. Um, Again, more microbiome, oral gut axis, dysbiosis. So a lot of these things, and this is either R01 or R21. So it's helpful to see that. Um, and again, these are predominantly those are the NIH ones, as the federal. It comes up with again, just like ChatGPT did, TRDRP, but it breaks it down a little bit more. So there's established investigator, there's new investigator awards, there's also community partnered participatory research awards. And then these are definitely have a strong community component. So it is for California institutions, it says. Um, and so, you can take a look. If you're outside California, you might be able to find partners who can you can partner with. It also found foundations, so American Diabetes Association, not the American Dental Association. Again, it gives a little more information about which specific American Diabetes Association awards. Um, this actually does say that the 2027 cycle is open now, but the deadline is coming up really soon, May 19th. And then there's another mechanism that is rolling, so ongoing. Um, and then it also came up with Robert Wood Johnson, and then Delta Dental Foundation research grants in the Ohio Valley, Michigan, Ohio, Indiana. And so these are other opportunities. These are a little bit smaller than federal, but that's typical for foundations. And foundation work is really good to add something that the feds don't want, or as a stepping stone to a larger grant that might be funded by federal. And then it also found finally, some industry. So again, it had these same Colgate-Palmolive awards. And as before, a bit more information. It's got the fit. So this is a 3-star instead of 5, 4-star instead of 5. And then, interestingly, it finds this Mars Wrigley Snacking Foundation grant. I know that the chewing gum industry has funded a lot of health research. There's some literature, some research and literature to show that chewing gum is good for your oral health and your dental health. Um, Providing the saliva to bathe your mouth and rinse your mouth after you eat is a good thing for your oral health. But it's interesting too because, paired with Mars, which is a candy company, which has sugar, there's some sort of potentially some ethical issues. Your institution may not be so interested in taking money from the sugar industry. And although it does highlight that xylitol or non-sugar sweeteners or sugar reduction components are part of some of their interests. So there's a lot here to dig into. And I will say again, once you get a search you like, then you can say, please send me updates every week on whatever day of the week it is, Monday, for example. But with these AI tools, I think you need to iterate, refine, iterate, refine, iterate, and then ask it to run each week. I will also say I hadn't, so the Chat GPT ones I did just this, I'm sorry, the Claude ones I did just this week to try out a refined prompt on a new LLM tool that I hadn't used before, and just to see what that results in, which was pretty good. But I will say that I found out about that ADAPT um, opportunity from NIH through a program official who I saw in person at a conference in March. That person at that institute or center told me, hey, we just got approval for this concept clearance, which has been working its way through the approval process for um, many, many months, actually upwards of a year. And we finally got the approval and, look for NOFOs to be coming out soon. Then I got an email on the day the NOFO came out from the program official who's in charge of the NOFO. That person didn't just send it to me. That person sent it to, a whole bunch of researchers that they are in contact with and that they think would be interested or would know people who are interested. So I will say I got those before I got any of the information. When I saw that NOFO listed, I went back to Chat GPT Enterprise. I did my search again. Had it rerun the same search. It didn't result in that result. It didn't include that new result that day. I then gave it a link specifically to that grants.gov or simplergrants.gov notice. And I said, why didn't you find this? And it said, oops, sorry, you're right. I should have found this. I'm going to update my algorithms and, try to reduce the chance that this happens again. So tools are great. They're just tools. They're automated. They can make our lives easier. They can make it helpful. But they don't replace the human connections. They don't replace the community intelligence that we have, the networking that we have as with people, colleagues, and with funders. I'll also point out that often with foundations, it's much more important to develop that relationship with the program official. When you find something that you think meets an opportunity at a foundation that meets what you're interested in, or at an industry contact, go contact that person immediately. Try to get them on the phone. If you can't get a phone opportunity, send them, your idea. You don't have to have a whole specific aims page, but it's a good idea to at least be able to write a few sentences about what's the problem? What is the what's the problem you would be addressing? What is the research you plan to do? What will it produce at the end that will help alleviate the problem? Because that person can stop you from spending a lot of time working on something that they're not interested in, or that person can get really excited about it, or that person can say, well, we're not exactly interested in that, but if you were to focus on XYZ part of that, we would be interested in that. So you get a lot more tailoring from foundations and industry contacts, and I really, really encourage you to connect with people and find out what it is they really want and how to produce that. NIH, of course, doesn't do that way. They will give you some feedback on your specific aims, but not in the same way that foundation and industry folks will. Yes, and definitely got to double check your AI. So that's my final note is even when you're using these automated tools, digital helpers, check them, trust but verify, but also don't abandon people and continue to rely on um,
Networks.
your actual networks with real people. So thank you all for attending. Thanks for dropping in today or dropping in to watch this video. And if anybody has any questions, I'm happy to take them. With the remaining time, I could even do a little demo if you are so interested.
Great. Thank you very much, Stuart.
Any questions for our speaker?
I quickly copied your prompt and like changed the ORCID and the topics to things that I'm interested in my profile and put it in GPT. It was interesting to see as it's doing its search, its logic and what it's doing. It's updating. It's like, it looks like you're an expert in this. Okay, now I'm checking that. Oh, there doesn't seem to be anything there. And so it's kind of updating you, and you can kind of see its thinking process and what it's doing before it prints out your summary. It was an
Yeah,
interesting
that's a good
process.
point. I did notice that, and Claude did the same thing. That tells you, where it's going to look. And you can interrupt at any time, and you can say, no, 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 don't look there. Look here. Don't look at NIH guide. They don't use that anymore. Like you can interrupt, which I didn't do, and give it a little more tailoring, or you can just wait. I mean, it didn't take very long to run. It took 3 minutes, maybe.
Yeah, yeah, that's
Um,
interesting. Very interesting.
So hopefully people found this interesting and useful. I think that it's always been an important thing to diversify your research portfolio, and I think now more than ever, as we've seen with issues cropping up, and so it's also a really great way to start your career. You don't have to jump to. It's almost impossible to jump immediately to a randomized controlled intervention trial. As a researcher, you really need to start with other stepping stones, and
Pilot studies.
whether they're secondary data analyses, whether they're policy, whether they are, working with community to find out about feasibility, working with the community to assess some different kinds of ways to measure and maybe patient-reported outcomes and things like that. There's a lot of stepping stones along the way to getting to an intervention study.
Thank you very much, Stuart. And thank you for the attendees. It was nice to see you guys.